Good morning. Looking good out there. Again, I'm here to share with you our journey at Allina Health. So we're a large integrated health system trying to figure out what our piece of the pie is in terms of this work to improve the health of our communities. So this may look a little bit scary. We're setting this in the context of our risk contracts. So as we move as a healthcare system into value-based care, where we are responsible for keeping folks healthy, instead of getting paid for the services we provide, we do that through risk-based contracts and managing populations, which for healthcare is a fairly new concept. We are traditionally trained to take care of individuals. Now we're moving into the zone where we need to make sure we're managing whole populations, and we're figuring out how to do that. One way we're doing that is through our integrated health partnerships, and you've heard a lot about this already this morning, but it's our opportunity to figure out how we manage our Medicaid population. And within Allina, we have 3 integrated health partnerships that covers 90,000 lives. And we decided very upfront that we needed to figure out what is the infrastructure that we're going to build to be able to do that, to be able to be a good partner in this journey with all of you. So we decided to focus our first year really on organizing. How are we going to do that? Well, within our own healthcare system, we had to make sure that we were organizing around analytics, that we were organizing with our operational partners, and that we were tying it to broader organizational strategy. So that's how we set up our infrastructure. And we decided very early on that we were going to make sure that we were building this infrastructure on data and really thinking, and when I talk about data, I mean very broad data, not just the data that we're used to looking at, but very broad data. And we needed to do this by conducting systematic analyses, really thinking about what are the analytic structures. So we had to start building our analytic structures in the way of tools, but we also had to ask ourselves, how are we going to look at this? What is the criteria we're going to use to identify the opportunities that we had available to us? What are the problems? What are the opportunities? And through our sifting process came up with 7 distinct buckets, social determinants being one of them. Once we'd figured out what our opportunities were, we needed to collaborate across our operational partners along with our community partners to figure out what can we actually do about it. And that's easier said than done. There's a lot of players in the room around this, and we needed to figure out how to collaborate well. And once we did identify what those opportunities were, we needed to make sure we were setting goals. What were we actually able to achieve? What do we want to achieve, and then what operationally can we actually work on? So that's how we were going to set our goals. And then this is a very important step, really thinking about what do we need. So what's an ideal state in terms of need? What do we have available to us? Those are 2 different conversations related to what we need. So getting very clear about what we have, what the ingredients are, so that we can start building our interventions. We needed to make sure we identify what the process was. And we have a very distinct thing that we use. We use our logic model as a planning document to build our airplane. And then we use that specific tool to help us determine what our measurement is. And we go in with a measurement plan. I think we have gotten often into a place where we start with metrics. And in our process, we start with the planning and then make sure that the metrics follow. And then once we've gotten into the habit of building our measurement plan and watching our interventions, we make sure that we circle back with our stakeholders, report back, and then listen to them and determine what we need to do to fix and refine and circle back as we develop these interventions and put them into play. We're never done with that work. So you can see how we had to build this infrastructure, and it was time well spent. We spent the better part of the last year really understanding how we were going to build this infrastructure in our large system. And then that can be our foundation for much of the work moving forward. And as a gymnast, we're currently in the process. As a gymnast, we know that they practice their routines over and over and over again. And they don't change those routines, they practice those routines. And that's where we are in our current process, practicing these routines. And what we're finding, what we've learned over the course of the last year is that in our IHP process, we're starting to see that some of the infrastructure build is starting to have an influence on how we're managing other populations, our Medicare population and our commercial. And once we build on this infrastructure, we can really rely on that infrastructure so that we're able to focus on what's most important when it comes to our journey to care for these populations. Thank you.